Welcome back. This week, the world comes together to mark World Breastfeeding Week 2025 with the theme Prioritise Breastfeeding, Create Sustainable Support Systems. Now, breastfeeding plays a vital role in giving every child the best start in life. But behind every successful breastfeeding journey is a strong support system, from healthcare providers to families, communities and workplaces. Here in Malaysia, the Ministry of Health and the National Lactation Centre are stepping up efforts to strengthen these systems through Jelajah BFHI Madani, a nationwide initiative under the Baby Friendly Hospital Initiative, or BFHI. Now, this program focuses on ensuring that healthcare facilities actively support and protect breastfeeding while raising awareness and building capacity across the country. Now, to talk more about the importance of sustainable support and how we can collectively prioritize breastfeeding, we're joined by Dr. SITI AHMAD, head of the National Lactation Centre and Reproductive Medicine Specialist at Hospital Tunku, Azizah. Now, this year's World Breastfeeding Week theme focuses on creating sustainable support systems. Doc, from your perspective, why is long-term support so critical for breastfeeding success?
For having us. So, as you rightly said just now, breastfeeding is the best nutrient for the babies, and every mothers and every parents knows this. But with every journey of breastfeeding, there is challenges. So, therefore, long-term support is very crucial for successful breastfeeding because it helps mother to overcome all these challenges, build up their confidence and sustain the practice as long as they choose. As we are fighting against stunting, non-communicable diseases like obesity, hypertension and diabetes, breastfeeding is so crucial to start as early as possible, and we have to uphold our national policy which promote breastfeeding up to 6 months and if possible up to 2 years. And early cessation of breastfeeding can lead to disappointment, distress and potential health problem for the mother and the baby.
Now, Doc, one of the key initiatives this year is Jelajah BFHI Madani, led by the Ministry of Health and the National Lactation Centre. How does this program contribute to building a more supportive ecosystem for mothers in Malaysia?
As the theme this year says, prioritize breastfeeding to create sustainable support system. So we come up with a new tagline or new ways on how to improve the support among the mothers. So we actually do the road tours to focus on empowering women and mothers then can contribute to a more supportive ecosystem in Malaysia by raising the awareness and providing the resources and fostering sense of community among the population. So we actually invite our lady bikers to come join together with us to start the program Jelajah Madani BFHI, which started in KPJ Seremban on the 25th July. And on last Saturday, on the 2nd August, we moved to another private hospital because we want to ensure that BFHI, breastfeeding among the mother and the population in Malaysia can be upheld. And this event can address specific challenges which faced by the mothers, such as the access to care, work-life balance, and the support, while also economic empowerment and the social inclusion during this Jelajah.
Oh, that looks very interesting. We're also promoting active women in the process. Now, what are some of the persistent challenges faced by new mothers, especially in the early postpartum period, that these kinds of support programs aim to address?
As we know, postpartum, you have a lot of hormonal imbalance, and the mother is getting to know the baby is getting to know the mothers. Hence, it's very important, it's very vital for us to give a proper support to the mother, because the postpartum period is very challenging, because mostly they will face with the physical recovery, mental health, infant care. Therefore, it's very important for us to ensure that this mother have as much as support as we can to ensure that the baby receive the best nutrients to kickstart their life, and the mothers also have the best support to ensure that the breastfeeding become a good journey to continue the nutrition, best nutrition for the baby.
Now, Doc, as they say, you can never be prepared for this. It's an experience, it's a journey, you need to be able to go through it. Now, in your experience as an ONG specialist, what type of consistent follow-up care or community support is most effective in helping mothers continue breastfeeding for the recommended duration?
Effective support for breastfeeding mothers include consistent follow-up, care, community support, such as home visits. I would like to highlight that about 50 plus of our clinic has a clinic rakan bayi, which means that they have a system where they can go to the house and promote breastfeeding and assist the mother who has some difficulty in breastfeeding. The BFSI initiative is actually hospital-based, whereby we have the lactation unit in every hospital, especially the government hospital, who promote and also give supports to the mother. And we have numerous support groups in the private sector as well, to ensure the mother will have best support during this trying period. And as a mother of 5 myself, even though I'm a doctor and some of my doctors colleagues and nursing colleagues, though we have the know-how, the knowledge, but the struggle is real. So it is very important for us to ensure that the mother, when they need help, they can get help from the clinic rakan bayi and also the support system from the hospital BFSI, which is available in 100% of government hospital and about 22% of our private hospitals.
Now, as you said, you're a mother of 5, and I'm sure each child, the entire experience can be different as well. It's not just a copy and paste as well. And especially for new mothers, not knowing how to manage the ongoing changes. As you say, the hormones are changing, the body is changing, the feelings that you have may be very disrupting. Now, how can healthcare professionals, especially those in maternal and child health, be better trained or mobilized to offer sustainable breastfeeding support beyond the hospital walls?
Well, we need to walk the talk. So basically, all the healthcare workers in Malaysia, especially in the government setting, we had undergone or has undergoing like a lactation course whereby it's compulsory for every doctors or staff nurses who are involved with the caring of the baby. So the healthcare professional, particularly those in maternal and child healthcare, should be better trained and mobilized to offer sustainable breastfeeding support through a comprehensive education, hands-on training and supportive policy, which is supported by the Kementerian Kesihatan or MOH, whereby we have a specific 20 hours breastfeeding course for our healthcare worker so that they can impart their knowledge and support the breastfeed. This includes helping them with the knowledge and skills and resources to make them able to effectively counsel the mother who has some issue. Because as you said just now, every journey of breastfeeding, even you have 5 children or 2 children, is different because your children is different and you have to adapt according to your child.
And also, as the body changes, the body ages, the body might function differently from the previous time as well. So many things change. I've heard of like friends and family members who may not take naturally to it. It doesn't automatically come just because you want it. And I think it's very important that the community, whether it's male or female, understand this. There's more awareness and are able to support mothers who want to continue breastfeeding. Now, finally, Doc, what is your call to action to communities, employers and policymakers to ensure breastfeeding is not only encouraged but supported at every level of society?
Well, to effectively promote and support breastfeeding, a multi-pronged approach is needed. So to involve the community, the employers, the policymakers. So community should foster a culture of acceptance and understanding, providing accessible information and support network. I remember some of my earlier time when I want to start breastfeeding. My mother is not so promoting breastfeeding because they don't want us to be in pain. So when you educate your mother on the importance of the support, you will come out a very nice journey for someone who want to initiate breastfeeding. And on the employer part, they should implement a supportive policy like paid parental leave, flexible working arrangement, alongside designated private spaces for breastfeeding. When I first started about 20 years ago, there's not many breastfeeding corner or room for in government building. But now it's a compulsory for us to have a breastfeeding room in our government hospital. So I saw that same initiative has been initiated in the private sector as well. And for the policymaker, they should enact legislation to protect breastfeeding mother and enforce the International Code on Marketing of Breast Milk Substitute and invest in comprehensive breastfeeding program. So when we do this thing together, the community and the policymaker and healthcare worker work hand in hand to ensure that the mother will understand the benefit of breastfeeding. I'm sure all mothers will eventually start and continue breastfeeding.
Thank you so much, Doc, for sharing that, and I hope that it increases the awareness. Now, that's all the time that we have for now. Thank you, Dr. Siti MAISARAH, for sharing your insights and for your continued advocacy. Now, let's commit to building a society where every mother feels supported, every baby gets a healthy start, and breastfeeding becomes not only possible, but protected and prioritized. Now, more global updates is just in a moment. This is The World on BERNAMA TV. We'll be right back.